You know what we're going to talk about?
Welcome to Back at It with Dr. J.D. Dudum from Dudum Chiropractic. Today's sponsor today is PillowWise. If you're looking for the most comfortable pillow that's going to help you get that instant relief in your neck, I'd highly recommend you go check out PillowWise, one of our favorite sponsors.
We're not filming. We are, but we're not.
You don't have to live in pain anymore. This is the podcast where you'll learn the stories, tips, and tools to get back to your path to health. I'm Dr. J. Dudum, and this is Back at It with Dr. Decompression.
This is the Back at It with Dr. Decompression, episode 48. I'm here with my great pal, Dr. Cameron Jahangiri, San Diego Chiropractic Neurology. Doc, say hello.
Hey, guys. Good to be back.
You know, we had you episode, I don't know, in the 30s when we opened the studio. You've had a lot happen with your clinic, a lot of growth we want to talk about. And then you and I were touching base the other day about some unusual stuff that we wanted to share. Sound good?
Yeah, so got another table.
How many now?
We're at 4, so we're not quite at where you're at. That's a whole nother level, but we're making progress.
It's a lot of volume.
That's for sure. We're growing.
Are you still seeing a lot of low back, more low back than neck? Or are you seeing more neck? How's that? What's the ratio of what you're seeing?
Oh, I'd say it's probably 60-40 right now.
60-40 low back to neck.
Yeah. Mm-hmm.
We were chatting. Give the audience some info, because obviously we talk about disc herniation, stenosis, bulge, all that stuff. But you and I were chatting as a follow-up to my previous podcast about uncommon symptoms of a disc injury. And you had some unique ones. Yeah, go ahead.
I really enjoyed that episode where you were discussing some of those ones, because I've definitely found my own, or I've noted some unconventional markers or findings that you could maybe that could help guide you into establishing early on whether or not maybe you're dealing with something like stenosis, disc injury, or sciatica, like you're talking about, something that's happening, an injury to your spine. So yeah, I thought that was a really great one, and I thought it'd be useful to share some of the ones that I've seen too, and I'm sure you probably noted as well. First one that I wanted to touch on, actually, probably in the past month, I've had 3 of these come in. Maybe 4.
Are they all different?
These are all just the same. They're all different versions of the same theme. So like for this first one, just talking about, you ever have somebody come in and describe like, I've got tight hamstrings, or I've got my hamstrings are short. Like, I don't know where doctors get this, because sometimes doctors will tell their patients this, oh, you've got to shorten calf muscles, or you've got to shorten hamstrings. Like, that's not a thing. That just doesn't exist. Now, can your hamstrings or calves tighten up and then become, or like get stuck in a shortened position? Yes, but they're not anatomically short, right?
Got it.
So anyways, I've had like a handful of patients come in recently, and they describe this, no matter what I do, I stretch, I do massage, I work on my hamstrings myself, and nothing seems to get these things to really relax. They're always tight. And for me, that over the years of doing this, I've learned that that's like it's a cue for me to check out the low back right away. It's when we have, grab this guy. So when we have, just looking at the spine, you've got the nerves that come out of the little hole right here, right? Mm-hmm. And even the one that sits in the space, the spinal cord that's going through the other hole, right? That
lift it up a little higher. There you go.
Right. So when we've got any one of these areas entrapped, where do these nerves go to?
They go to the lower back, down the legs, to the feet.
Yeah. So if we're talking about the low back, then it's going to go to the legs or the glutes or whatever it might be, right? And if this guy is irritated, let's say the hole is collapsed, or there's a disc pushing into it, whatever it might be, that nerve is going to get irritated, right?
Yes.
And what are some of the symptoms you might feel with that?
Common symptoms would be like numbness, tingling, pain, like you would have a sensation would be the common symptoms you've had, correct?
Right, those are like traditional signs,
Traditional
right?
common signs.
Common signs. Now, what else happens with the muscles when this guy gets pushed into?
The
Or
muscles,
he gets
the
pinched?
nerve is going to control the muscular function.
Yeah, so it controls muscles. So what might happen to the muscle?
Well, the muscle is going to be reacting and contracting.
It could contract.
Yeah.
That's right. So if
You're
you've
quizzing me.
got
I
that
love this.
happening,
I love it.
yeah. So if this is happening on both sides, like both the holes, this is the right side, this is the left side, and you've got that hole collapsing, or you've got a disc pushing into both sides, what might you experience in, let's say these nerves, they go to your hamstrings, or that they ride the whole sciatic nerve, goes down the back of the leg, so it's going to hamstrings and calves. What might you feel with the muscles there?
Those muscles are going to feel tight and they're going to
Yeah.
feel shortened. That's what they're going to feel like without, and
Now,
possibly without nerve pain, right?
exactly. You can
Yeah.
have that without nerve pain. You can have that without numbness, tingling, burning, any of the nerve stuff, right? You might not even have pain in your low back. You might just feel tension down the back
Yeah.
of the leg, and it might be both legs. Okay. So if you're somebody and you don't have any pain, you don't have any nerve sensations, and you're feeling this tension down the back of the leg, what are you going to do?
Probably foam roll, stretch, use a stretching band, something like that.
Exactly. So you're going to try everything you can to try to relax the muscle, get it softened up. You might massage it, you might
Massage
stretch
it.
it. And what's going to happen? Is it going to get better? Is it
You
going to
know,
change?
it's gonna happen the next day, and then you're gonna stretch every day, and then you're gonna think, you know what, gosh, if I just stretch 3 times a day, it might get better.
Yeah, exactly. And then you're going to
Totally.
get to a point where it's like, man, I've been doing this for months and nothing changes. So I must just have chronic tight hamstrings. Like these, I
Genetics.
always, yeah, that no matter what I do, I'm stiff, right?
Yeah.
And then you come into one of our offices and you get the appropriate stretch. You take that hole and you make some space for the nerves. And all of a sudden, we're testing your hamstrings out, and now you can touch your toes.
When you say test the hamstring, you mean like you're just doing a toe touch?
Yeah, you can have them toe touch, or you can raise the leg, right? We'll often do an orthopedic test, right, to test for sciatica and disc injuries and all of that, called straight leg raise, where we lay the patient on the back and we pull one leg up to see if it's going to provoke the symptoms, right?
Yeah, so you're saying basically if they have a tightness in the hamstring that they feel, that they always stretch, when you do your testing, that pull test that we discussed, you're doing that test, and let's say they can't touch their toes.
Right.
You pull test, it gaps. You're describing gapping the spine, creating space, and then all of a sudden they can touch their toes.
Exactly.
They're
going to gain some range
cool.
back. They're going to feel like, oh, that is a little looser. That's weird. It's a little easier, right?
Yeah.
So historically, what I found, when patients come in and they describe, I've tried stretch, like I have stiff hamstrings or tight calves, and it never goes away, no matter everything I throw at it. I've tried massage, I've tried stretching, I've tried foam rolling, I've tried all these things. Then it's already popping onto my radar. My spidey sense is popping up, right?
Got it.
And it's telling me, okay, something might be happening in the low back. Something could be happening where it's pinching some of those nerves in there and just giving you chronic tension.
That is some cool insight. Are there any other symptoms associated with that you're looking for, or just the tightness? I'm stretching, foam rolling, etc. It's still tight.
Of course, we're still going to be listening for, are they describing any of the more traditional signs?
Yeah.
Right? Do you have numbness and tingling? Do you have back tension or pain? Do you have sciatica? Right? Any of that stuff, it's like, oh, it's just adding to the case. It's cementing, my thought process.
So you're asking those,
sense?
but yeah, did those patients present with any other weird non-traditional symptoms?
Oh, so if we're moving down the list of other non-traditional, like,
so move on to number 2. Got it.
Yeah, so let's move over to number 2.
That was fascinating.
Yeah, so pretty cool. That chronic tension and stiffness. But number 2 a really good sign that I've found is when patients describe that they feel sore on a consistent basis, or their legs feel tired, or they feel weaker in general. Okay.
Okay.
A lot of patients will put the blame on things like, I haven't been as active as I usually am, or I'm getting older, but these aren't necessarily, yes, there's going to be some level with aging that your legs are potentially going to get a little deconditioned or a little bit weaker, because there's no way we're as strong as we are in our
Yeah.
20s and our 60s. But that being said, if your day-to-day activity hasn't really shifted and you're still doing about the same amount of stuff that you used to, your legs shouldn't just get chronically weaker or feel sore on a consistent basis. Some patients will describe that they feel like, I feel like I walked like a few miles the day before, but I hadn't done anything. Or I feel like I ran a marathon, and they just wake up, and throughout the whole day, their legs just feel like tired, like they had used them a lot, right? And they might be sore.
And part of your
There's
process
not,
would be, have you increased exercise? Are you training for something? And obviously they would say, no, nothing's changed, right?
yeah,
Yeah.
exactly.
Okay.
Nothing's changed. I'm just feeling soreness in my quads. I'm feeling soreness in my calves. My legs just feel tired in general, whatever it might be. And that's another thing that's again, similar to the tension in the legs, that I'm going to be looking for, listening to, and stacking that against the exam and seeing how that stuff all coincides. So when, again, we've got we've got these guys getting pinched, the nerves inside the canals or the tunnels, right? And they're getting irritated. What else rides along with these nerves?
I'm gonna go with blood vessels.
Yeah, blood vessels. Okay. So we've got blood vessels or blood flow that go with these nerves. And if you pinch some of these areas, that's going to do what? Is that going to change? Is circulation going to go up or down into the
It's
legs?
gonna decrease circulation.
It's going to potentially decrease the
Yeah.
circulation going down in those areas, right? And if the circulation is reduced, how's the recovery going to be with your legs?
You're
Wherever the
describing,
circulation goes.
yeah, you're describing like pooling and lack of blood flow and that in the legs, which requires
Yeah,
movement. Yeah.
exactly. And what's going to happen, because on a day-to-day, when we use our body, we're breaking it down at the same time, right? And we're constantly repairing it. Every time we use it, there's some sort of repair process that has to happen. How effectively are we going to be repairing the tissues down in our legs, and clearing out the waste and all that kind of stuff if our circulation is impeded?
It's going to reduce it, right? We're decreasing the amount of oxygen and nutrients to the tissues, and then we're increasing the waste in the tissues, not removing it properly.
Exactly. And
Yeah.
what kind of waste would increase in those tissues then that could make you sore?
Lactic acid, carbon dioxide.
Exactly.
Yeah.
Right.
Am I passing this test right now?
What's that?
Am I passing this test? I feel like I'm getting
You're
quick.
crushing
I
the
feel like we're
quiz,
back
man.
at Life West.
Yeah, you got
Oh
one
my
more pop
gosh.
quiz. Yeah.
I'm supposed to be asking you
So
the questions.
you can have this change in the chemistry in the legs, and it can be due to the change in circulation, right?
Yeah.
The pH is going to change. It's going to make the pain receptors more sensitized. It's also going to increase the lactic acid. It's also going to make things more painful. You're not going to bring in as many of those good nutrients like oxygen and whatnot that help repair the tissues. So everything just kind of slows down and it's delayed, which is why also when these people try to work out their legs, it could be like a week-long recovery for them. It can
Got
take
it.
a while. So then these people tend to avoid wanting to do things that really work their legs,
The
put
recovery's too
demand
long.
on their legs.
Yeah.
That makes sense?
Now, how would you compare this versus the first one? Because the first one was more nerve controls muscles, tightness. This one is, you're talking nerves control blood flow, right? Can you describe the difference?
They ride together. So wherever you have nerves traveling, wherever that wiring is sitting in your body, you always have blood vessels that go with them. Because the blood vessels keep them healthy. You need the blood flow to keep all your tissues healthy, but the nerves are some of the most important tissues in our body, which is why they have blood vessels riding right along with them.
Fascinating.
Yeah.
So it could be the
Does that all make sense, right?
same level, same type of injury,
Yeah.
just affecting the nerves differently, whether it's blood flow or muscular function.
Yeah. And
Wow.
this isn't like me saying, this person's just got no blood flow going to their legs.
Yeah.
It's not that it's stopped completely. It's that it's being impeded a bit. There's
Yes.
a level, off the top. It's just working inefficiently compared to what it used to. And when
Totally.
it's not running on optimal, you're going to notice, something's a little different.
Yeah.
I'm not recovering as fast as I used to, or I'm a little bit sore on a daily basis in my legs for some reason.
So what would
And
be
my
the
level of activity hasn't changed.
what are the three symptoms then? Let's say, hey, they've got this. What are the three things you just kind of mentioned it, but like bullet point it for the listeners? If they're
The
what?
three things.
ABC. Yeah. Slower recovery, achiness, that kind of thing.
Yeah. So you could notice that you're recovering a little slower.
Okay.
That's one thing. You could notice that you have this consistent soreness in those tissues or in those body parts, right? They're always like that. And those are really the main two. You might notice that your legs run a little bit slightly colder than they used to too,
Okay.
in general. Okay, so that could be another thing. And you can move along the spectrum where things are really extreme, and you start developing like extreme coldness, and the tissues your legs start to get more dry on the skin. But
Yeah.
I'm mainly with this. People at that stage have usually gone and seen somebody, and it's no longer a mystery. But like when you're in that gray area where it's just like the circulation is just being impeded a little bit, then you might experience some of those what we call subclinical signs, where it's like
Got it.
my legs are a little bit colder, I'm a little more sore, I'm just not recovering like I used to with my legs.
And I mean, coldness in the legs could be synonymous with neuropathy.
It could be too, right?
Yeah.
So you can see that in neuropathy as well, but you can also see that with impingement in the back, like nerve impingement in the back or sciatica. So they can be a little bit confusing for some patients, and for some doctors too. Like we've talked about this in the past. People can present with a neuropathy in the legs, but realistically it's coming from the low back.
Yeah.
And it gets missed on a consistent basis, and they're trying to look for diabetic neuropathy or some other thing that's injuring the nerves in the legs specifically, when realistically you have to look higher upstream to where the injury actually has happening.
That's a fascinating explanation to why you may have neuropathy or neuropathy-based symptoms when their feet are cold, and it's due to a lack of blood flow because the nerve controls how the blood flows.
Yeah, it's going to influence
Yeah.
things. They
Yeah.
they work together. So yeah.
That was fascinating. Very cool. Give us number 3.
So number 3 is a very interesting one, and this is something that there's not a lot of research on this stuff.
No research? Is this groundbreaking?
There's not a lot of good research on this
Okay.
this particular area.
This is a clinical trend
this
that
is
you found.
Yeah, this is a
Okay.
clinical trend that
Cool.
I found. So, one of the things that I've noted in practice is some patients will be very ticklish in their legs.
Okay.
And they'll report to me like, oh, and it'll usually be when I'm testing them on the exam, like I'm checking how the muscles feel and stuff, and just seeing what the tissues feel like in the legs. And the patients will describe, oh, I'm really ticklish. And they're like,
Okay.
they'll pull away. They're really aversive to me working on the legs at all. And it might just be certain compartments of the leg that are really sensitive. And what I've noted is when patients have that, they're really ticklish, or they might even tell me like, hey, I'm really ticklish when we're just talking in the history. But when patients are really ticklish in the legs, there's a test that we do, and it's called a Babinski test. And that's where we run, if you've ever gone to a doctor and they're tapping your knees and whatnot, they're testing the reflexes in your legs to see if you kick and whatnot. There's another test that they can do where they go down to the bottom of the feet and they run a sharp edge to the bottom of the foot. And that's usually on the reflex hammer. I don't have mine. Actually, yeah. So
Doc, we're scaring people. Running a sharp edge on the back of their
sharp edge run it
Okay.
along the bottom of the foot, and there's a normal response that should happen as an adult.
What
Now,
should happen?
when we're adults, our toes, as we run that sharp edge, should curl down.
Our toes curl down as adults.
Curl down. Yeah, it's a
Okay.
healthy response. It's a little bit of a reversive response, but that's the reflex. It just curls down. Your foot shouldn't pull away or be really hypersensitive to it. And the toes definitely should not go up. It shouldn't flare up. Okay. And what this is testing, it tests multiple things, but the main thing that we're looking for is if there's an injury to your spinal cord,
Okay.
your brainstem, or your brain. Okay. Very rarely do people come in and see me that have anything happening to their brain or brainstem. So for us, we're mainly focused on has something happened to the spinal cord?
Okay.
Okay.
Are you looking
And if
for
something happens to the
disc
spinal
on the
cord,
cord, or what are you looking for regarding the spinal cord?
yeah, is a disc. Do I suspect that there's a disc pushing into it? Do I
Got it.
suspect that there's stenosis, like narrowing of those tunnels where the nerves go through?
Okay, got it.
Anything that's injuring those nerves, right? If there is an injury to the cord, then the toes, when we run that sharp edge, will potentially flare up, or they'll be really aversive to the touch, and they might be ticklish.
Ticklish.
Okay. So they'll be really sensitive to those sensations. Yes, it's okay for you to be sensitive to an edge running on the bottom of your foot, but there's a very normal response and there's a hypersensitive response. And a normal response, like a majority of people will not pull away from this. They'll feel it, they go, ugh, you know, they'll be cringe about it, but their toes will still go down and they're not going to pull their foot away from me and retract. Okay.
Got it.
On a consistent basis, what I've found is that when patients are hypersensitive on the bottom of the feet, or they're somewhere in that transition period between they have a Babinski or they're aversive to the touch.
Okay.
And they're sensitive to it, they're going to be ticklish in certain parts of their legs potentially.
On both, or one more than the other? How does that work?
It's typically, usually when I see this happening, I'll find it on both sides, but one side might be worse than the other. And once that side of the leg that is worse typically is more ticklish too.
Okay. And
this
patient may have pain too, or hey, they might not have pain, but they're having an issue. Like, why would you
They
look
may
for
or may
this?
not have pain.
Got
Just
it.
like the other ones. They may or may not have pain. They might just have chronic tension in the legs. They might just be ticklish in the leg. Okay. So it really just depends on what part of the nerves are irritated.
Wow.
That'll dictate what types of symptoms you get. And part of the reason why I suspect that this ticklish sensation is happening is because our spinal cord acts as a brake pedal for how much sensory information is coming in from our legs. So it helps gate how much input or information makes its way up. Okay. So the brake pedal is not working. You're going to get flooded with, oh, that's really sharp. And you're not going to have a way to dial it down as effectively. And similarly to when we do the pull test to try to gap that space and take some of the load off of the nerve, after we do that, we'll often find that Babinski will be less sensitive.
Wow.
Or that sharp edge will be less sensitive on the foot. And then all of a sudden, when we touch those parts of the leg that were really ticklish, they're not as ticklish. It's gone down. And
that's crazy.
The response from the patient is like, what the heck?
Yeah.
How is that possible?
So when you pull, if someone has a Babinski sign that's abnormal, which would be going up, right? They go up, which would be abnormal. Right. You do the pull test, you create some space. You redo the Babinski test immediately, and you're saying that instead of flaring up, either flares up less or it curls down and becomes normal?
Yeah, it'll either be less sensitive or it'll actually start to curl down.
Do you have this is our clinical, do you have a patient experience about this and like a story or an outcome?
Actually, I just had a patient yesterday that I did this with. So that's how I was like, oh, this is a perfect time to talk about this.
Why don't we talk about it?
Yeah, so this guy is he's a 60-year-old from Sweden. He's got some pain in his back, but it's like a 1 or a 2, and it's more like tension. is what he's
Tightness,
explaining. So he's
tension.
like,
Okay.
yeah. So it's actually like a combination of what we were describing. So it's all three of these uncommon signs he came in with yesterday.
Wow.
He's like, yeah, I've got chronic tension mostly in my low back. And then, you know, if I really golf hard or like do like, you know, 2 rounds, by the end of it, I might have some pain in my back. But outside of that, I don't really have anything that travels down. You know, I do have really tight hamstrings, and the doctor told me that I have short hamstrings. I'm like, that's doesn't make any sense. It doesn't exist. And then he describes that, yeah, my legs get sore. Or he's like, they feel they don't recover quite as well as they did, you know, 10 years ago. And they're always a little bit sore, but you know, it's nothing that bugs me. It's like,
Yeah.
you know, I just assume that it's because I'm getting older. You know, and it's just normal. And I'm like, okay. And then we get to testing his legs, and we test the Babinski, we're testing his reflexes. The other thing you might see with their reflex when they kick, like if you tap their knee, it's going to kick a lot harder than
Oh,
it should. So it might
okay.
start kicking harder than it should because, again, things aren't being gated properly. So then you're having hyper responses to things or excessive
Got
responses.
it.
Okay. So brisk reflexes. And then we test the bottom of the foot, and he's like, whoa. And he does that mostly on his right side, but his
Okay.
left side, he has a little bit, but it's nowhere near the right side. So we then do the pull test, and that Babinski starts to taper off, probably shifted it like 15-20%, but it was enough for
Wow.
him to notice. I'm like, does that feel different? He's like, yeah. He's like, it's not as sharp. I'm like, cool. Because he wasn't pulling his foot away anymore when we do it. And
That's
then,
crazy.
yeah, same thing on the left, just a little bit. He just kind of retracted a little bit. He's like, okay. He's like, it's not as bad. I'm like, okay, cool. And
Wow.
then we check his legs, and they're not as ticklish anymore. And then we test the straight leg raise, we raise it up, and it's going up 10 to 15 degrees higher than it was. And he's like, yeah, it
Huh.
feels looser. And he's like, I don't feel it in my back anymore either. Because when I was testing it before, he's like, I feel the tension in my hamstrings, like they're tight, but I also feel it in my back. So it was like a roadmap, right? And
Wow.
then second time around, no tension in the low back, and you get 10 to 15 degrees more out of the hamstring.
Just from a test, not even the
Just from
treatment.
a test. Yeah. Well, now I hold my test for like, you know, 20, 30 seconds, but yeah, it was a very small challenge to the system.
Yeah.
And now
Wow.
no changes in the, you know, I didn't really ask him about the soreness or anything like that, but just seeing those findings change like that is always a really good sign for me. It's like, we're definitely in the right area. And more important than anything else, we need to run an MRI to confirm what I'm seeing.
Got it. So you're going to get an
Okay.
MRI test
So
to see what's going on in the
everything's
lower back.
pointing in the right direction.
Yeah.
I'm very confident in what we're going to be doing, but I want to confirm it on the MRI so I know exactly what we're looking at. Because this guy has been at this, he says, I've been having this for 30 years. And
30 years.
it's progressively gotten worse over those years. And I'm like, okay, that's a
Oh
really
my
long time
gosh.
to be dealing with that. And he attributes it to an old swimming accident. But anyways, I told him, I'm like, nobody's really dug into this properly. The only thing that was ever ran on you was an X-ray of your low back. It's kind of insane to me. Let's get an MRI. It's going to tell us a lot more.
Way
And then
more information.
yeah, and it's very likely that we're going to find the root causes in there. And we're probably going to find an injury to those bottom two discs, probably L4, L5, L5S1 is what I'm suspecting. And we're probably going to see stenosis in there as well, some arthritis where there's extra bone building around, and those holes have gotten smaller. Because he also describes that when he's upright, when he's standing, it's worse, or it gets stiffer, right? And any activity, it potentially creates more tension and potentially pain. But when he sits and he slouches, he feels better. So
Okay.
this is an
Wow.
older injury. It's been there a while.
30 years. How many doctors has this guy seen?
Oh, dozens.
Dozens.
Tried a lot of alternative options, and he doesn't, you know, it's not severe enough to him to where he's gone to a surgeon or anything like that, which is probably why he hasn't really gotten an MRI either.
Yeah.
He's tried a lot of stuff, and yeah,
Man.
has not
Wow.
gained traction. So
Okay, we got to do a follow-up so we can see and is he scheduled for an MRI?
He's scheduled for an MRI, but he's out of town for the next couple weeks because he's
Okay.
from Sweden. So he's got to go back to Sweden, and then when he comes back, he's going to do his MRI, and then we're going to get going.
Okay, I
See
want to
if,
do a follow-up in about 6 weeks so we can see how much better he's doing.
yeah,
Wow.
that'll be a really good one.
Dang. So
Yeah.
sum up those three things for me. The three main uncommon findings you're seeing.
So first one is we're talking about the. Did we talk about tickling, or which one was first?
We talked about sensitivity, like hyper
Sensitivity,
reflexes,
soreness, and then the first one,
the tightness in the hamstrings,
yeah,
foam
that's
rolling
right,
your
chronic tension.
hamstrings every day,
Yeah.
forever. Yeah.
Yeah. So if you feel like you've had chronically tense or stiff or tight hamstrings or tight calves, those are one thing that should be firing off that siren in your head that maybe I need to get my low back checked out.
Okay.
Maybe I need to see if there's something happening there. If you've already tried foam rolling, you've tried stretching, you've tried all massage and all that stuff, and it just comes back, it's a clue that it might be coming from further upstream.
Check out the lower back. Okay.
Yeah, something that controls those muscles might be higher up. Second, the soreness in the legs. If you feel like, yeah, my legs are consistently like a low level of soreness or a lot, very sore, they don't feel like they recover quite as effectively as they used to, or maybe they're a little bit colder than they usually are too.
Mm-hmm.
And that could be a sign of some circulatory changes.
Some coldness.
And that could be a sign that, again, that something could be happening higher up. Could be other stuff that you might want to look into, but the low back is definitely one area you want to address or make sure it's evaluated properly.
Okay.
Yeah, those discs and the nerves in that area. The last thing is, if you notice that you're very ticklish, you know that you have very ticklish legs, more, compared to other people, you're like, oh, my legs are just super ticklish.
I'm just
Or
ticklish.
you go to the doctor and they're
Yeah.
trying to, or like a massage therapist or whatever, somebody's working on you and it's like, oh, that part of my body is really ticklish. Then it could be because there's an injury to the nerves that help create, gate that sensation, help calm those nerves. Those nerves might be irritated.
And I guess if someone's wondering, hey, maybe I'm just always ticklish, or if they weren't that ticklish and they become like, God, I'm a lot more ticklish than I used to be.
Sure.
Right.
It usually patients aren't that self-aware, but if you know, like, why am I so ticklish now in that part of my body when I wasn't before? Yeah, sure. Definitely look into it, because that's not how that's supposed to work.
That's not normal.
Yeah.
Wow. Those were three. I'd say for me, the first one's is usual or common, like the tightness in the muscles, hamstrings, piriformis, whatever. Those other two are kind of, those are different.
Right.
Yeah.
Yeah. Keep an eye out.
I'll keep an eye. That was cool. So if you're Doc, how does someone find you? How do we find you?
Website, sdchironeuro.com. Or you can just Google us, San Diego Chiropractic Neurology. We're located in Sorrento Valley, San Diego. And yeah, that's probably the easiest way to get in contact with us. And you can always text or call any of the numbers that we have listed on there.
And then say the number, we'll put it here on the video.
Phone number is 619-344-0111.
Okay. If you're dealing with traditional lower back, sciatica, herniated disc, stenosis in the area of San Diego, or if you just listen to this and you're like, that sounds, I've been foam rolling my hamstring for 2 years and it's hasn't changed at all, go see Dr. Cam, and maybe it's a disc injury. It's possible. He sees it every day. So any closing words, Doc?
No, just keep an eye out for those signs. If you're somebody that's dealing with any of that stuff, like I said, it'd be a really good idea for you to have somebody properly evaluate your low back, have somebody look into how the spinal cord's functioning, how those nerves that come out from the spine are functioning. That way you're not chasing something that it isn't. Or you're just normalizing it. Don't normalize this stuff.
That was well said.
It's okay to feel like you're 30 when you're 50.
Don't normalize this. I like that.
Yeah.
Awesome. Thanks, Dr. Cameron. And thank you for listening. Don't forget to subscribe to the channel. And then episode 49 is coming next. Thanks for listening.
Thanks, guys.